It's Memorial Day and many families will be spending the day in the sun, but there's something you should be aware of: heat exhaustion. We reached out to our friends, the experts at Adventist Health Castle, to tell us more about the warning signs and what you should look out for. Dr. Takkin Lo here with us this morning to talk about heat exhaustion. Good morning. Thanks for being here.
Good morning, Christine.
Yes, Dr. Lo, tell us more about what heat exhaustion really is.
Well, Christine, our body naturally can get rid of the heat in our body by sweating. When the environment that we're in get very high temperature, and the humidity is high, the body ability to sweat is no longer there. And that's what messes us up, so that we're no longer able to get rid of the heat, the body heat that we have. And that's when you start to have symptoms of heat exhaustion.
And speaking of symptoms, what are some of the symptoms?
Well, the symptoms you can actually, first thing, amazingly, is that you actually have excessive amount of sweating. So you actually sweat a lot more than you would anticipate. Then you're going to actually have pale, cool skin. You're going to actually start to have muscle cramping. Then sometime you're going to get dizzy, you get weak, you get confused, and then eventually you're going to get nausea. And problem is, you may have to throw up. And when you throw up, you lose a lot more electrolytes. You get shorter breath, and you get palpitation, like your heart is racing. And then eventually you might end up with a heat stroke. Not beyond the heat exhaustion, you end up with heat stroke, where you're going to start to have actually, no longer are you able to sweat. Your body get very, very hot, and you might end up with seizures.
And who's most at risk for heat exhaustion?
Well, these are what we call the extreme of ages. So these are people like the younger one, the little kid, and then the older population. Some people that have, you know, that you normally would anticipate worrying about, the older and the young, but also patients that are people that are actually pregnant. And people that have medical problems, such as like patients with emphysema, asthma, diabetes, heart problem, patient actually obese, overweight, poor physical condition. They can't really do as much as they are able to. And
doctor, what about people who work outside and have a lot of jobs that deal with direct sunlight?
You're right. Those people that actually are hard worker outside, in spending a lot of time of their days working outside, getting exposed to a lot of heat, as well as those patients that actually are what they call hard chargers. These are people that are marathon runner, exerciser, that actually have just forget about warning signs and not paying attention to what their body is like.
So how do we prevent getting heat exhaustion?
Well, you know, there are many, many things. The first thing is actually make sure that you drink enough water before you even do your activity. So such as 8 to 16 ounces of water, you know, an hour or so before you exercise. How about drinking, making sure that you drink before you get thirsty. So you don't wait until you get thirsty and drink. And when you drink, make sure you don't drink caffeine. You don't drink alcohol. You know, stay cool. Use your skin protection sunscreen. Wear a hat. You know, the protection sunscreen, 15 SPF or more is really highly recommended. And then, you know, try to take a lot of breaks. Try to avoid the time of the day when it's hottest, which is generally between 10 o'clock in the morning to 6 o'clock at night. So you want to exercise, you're going to exercise, do it before 10 or after 6.
Okay, and what are some of the treatment options?
If you actually develop heat exhaustion, the most important thing, I think the first thing you do is get out to a cool place. So I say, you know, get out to a cool place, get off the heat, stay in the shade, lay down, be cool. Lay down, put your feet up, because you are probably dehydrated at that point in time. And then try to get a towel, cool towel, put it around your neck, put it around your head, around your head area, and then drink cool water. But drink it slowly. You don't want to kind of rush it into your body temperature, might not get ready for it. Take cool shower, or even if worst case scenario, we have a lot of pond and stream, just dunk yourself in there, keep cool, and I think that will help you.
How do you know when to call 911 or go to the ER?
When you're starting to have the temperature that stay above 102 degrees Fahrenheit, for more than 30 to 60 minutes, that's the time to call. You want to make sure that if you are still having the symptoms and you're not getting rid of any of these symptoms, call 911 or call medical provider that will help you. Remember, though, last thing is, if you have history of heat exhaustion or heat stroke, you're going to be prone of getting that again.
Okay, so everyone needs to watch out, especially the summer is here. We need to really stay cool and also watch out because we kind of take it for granted that we live in Hawaii and it's like this year-round, but heat exhaustion can really creep up at any time.
You're right. So, Christine, I'm going to tell you, stay cool and be cool.
All right. Thank you so much, Doctor, for being here. Dr. Lo from Adventist Health Castle. Thanks so much.